Welcome to SRBC 2022 conference. It is organized by CCMB and Hyderabad University. So the broader theme of this conference is to cover the reproductive biology and the endocrine system, covering the reproductive and neuroendocrine systems. So with this, there is a very common theme that exists in our society is the diabetes in women. So a lot of people believe that diabetes is associated with eating a lot of sugar, a lot of calories and all. So is that really how that happens?
Yeah, so you yourself actually just mentioned association. So a lot of factors, risk factors are associated. In that actually the sweets and the calorie consumption is very, very important. If you look at actually, the Indian diet transition, that is what actually makes the difference. So earlier actually, we are a kind of, uh, hunter gatherers.
Okay.
So Tripti genotype, status. So we start accumulating actually fat and actually storage and other things like that. That is actually a timing of actually, the cycle of uh, famine and fasting kind of thing. So, but now with affordability, people actually start consuming more calorie, and definitely, that is a cause for concern not only for diabetes, for many other, the complications and metabolic disorders. See, most importantly, if you look at actually data, whether it is starting from model organisms, Drosophila, zebrafish, C. elegans, then the rat and mouse model, and then human studies, definitely 30% of calorie restriction has a very good effect on all health benefits, lifespan increasing, health span increasing, and then even preventing diabetes and diabetes complications kind of thing. So calorie consumption should be actually, very, very important.
Yeah.
In fact, actually, as I was writing, actually, I told I am also a science communicator. I write small article like that. So sometime back, actually 15 years back, I was writing, there was a study, calorie study. And based on that, I was writing something. And then at the end, actually, I put a word, what it is actually, calorie consumption, that is particularly excess calorie consumption, will have a credit card effect. More you consume, more you have to pay for it at a later stage. That is a penalty.
That's so great to learn. We are sure we have to check the amount of calories we take in.
Yeah. And
So,
another actually thing is, you call, the sweet kind of thing. So definitely actually, the sugar and, diabetes connection is there, and particularly glucose and fructose. So what we are taking as the table sugar, it contains glucose and fructose. And fructose is actually 10 times more reactive than the glucose. And because of fructose consumption also, there is a lot of actually concern. That is what we see in actually, the sweetening drinks.
yeah.
Also, the bakeries and, the sweet stalls, they use a lot of fructose.
Is it always about what we intake, or does our environment also influences our chances of getting diabetes? If is it like that?
No, the environment is actually, it is a very, complex, area. Definitely, see, for example, diabetes. There is a strong genetic predisposition. Everybody knows, particularly South Asians, Indians. But when you see that last 15 to 20 years of work, including in my lab, actually, one of my colleague actually works on genetics, more than 200 genetic variants have been identified to predict risk for diabetes. But they have a subtle effects. They can explain only 5 to 10% of the risk. And rest of them are actually related to epigenetics and environment. And environment is actually, it's a very complex actually. Environment can be actually a pollutants, your diet, and the lack of physical activity, and even actually exposure to viruses kind of thing. So recently, we have this virus and onset of diabetes and all these kind of things. So those things, environment definitely plays an important, culprit actually, in the
Okay.
genesis and also the progression of diabetes and its complications.
And, where we live in also has influence over what all disorders we can get.
Yeah. See, that is why there is a terminology called, it's a separate specialization, built-in environment.
Oh,
The built-in environment means, so where you live, whether you have a park, what is your neighborhood area, what is your commutation, what is that actually, the facilities you have, all these things are actually, coming into picture, and they have actually, have a role in actually health and disease kind of thing. So this built-in environment concept is very, very important.
yeah.
Even the new cities are actually developed with this concept. So
Mhm.
greenery areas and all with all concepts of built-in environment.
We know that some of the women develop diabetes during pregnancy. This phenomenon is called gestational diabetes mellitus, or GDM. As your lab works on understanding the causes of GDM, how can we improve women's health conditions for early detection and to prevent it altogether?
Yeah, this is an important area. I have a lot of interest actually, because people initially thought that the transient gestational diabetes mellitus is just for a few days during the pregnancy and then it is gone. But all emerging data for the last 20 to 25 years, it is big cause for concern for the future development of type 2 diabetes, not only in the mother and also in the offspring.
Okay.
But the problem is, everybody comes to actually the pregnancy actually testing during the 24 to 28 weeks. That is the beginning of the third trimester. During the time, they will actually, diagnosed for whether they have a GDM or not or something like that. But we have to actually get actually some test even in the 10th to 15th or 14th weeks, the first trimester. And that is where a lot of biology, a lot of actually investigations are going on, because the conventional actually risk factors such as BMI and the family history and also the anthropological measurements, they all actually can explain only 5% or 10% of developing risk for GDM. So we need new markers, and that is where actually a lot of research is going on, whether we can identify actually 10 to 15 weeks during the pregnancy period, is there a risk? If it is found, then there is a big window of opportunity for prevention, whether it is a non-pharmacological lifestyle modification or some management through pharmacological management. Then actually, GDM can be prevented, and the subsequent type 2 diabetes development can also be prevented.
When we talk about that gestational diabetes mellitus, we believe it's a very transitory existence of diabetes. So during this time, are there any chances that a mother passes on this disease to the child?
Yeah, exactly. This is what actually, it is not actually just an inter-individual effect. It is a
Mhm.
transgenerational effect. So
Okay.
what happens is, even the placenta gets altered, and through placenta barrier actually, even through the cord blood, it is transmitted actually, the risk is transmitted to the child. And even the neonatal actually children, they may not have actually problem in the beginning, but once they come to the adult stage, 12 years, 13 years, 15 years kind of thing, they may actually predispose to actually a lot of cardiometabolic risk factor, diabetes kind of thing. So
Okay.
on an average actually 20% of the GDM people, within actually 2 to 5 years, they are developing type 2 diabetes, even though they have actually it's gone actually after the pregnancy, but they have regaining actually type 2 diabetes within 2 years, at least 15 to 20%. So it's a big concern. Actually, it is adding to the epidemic of diabetes, because in
Yeah.
India now have actually 75 million diabetes kind of thing. So maybe a big proportion is due to actually GDM also.
Okay.
Always, I always tell actually, diabetes prevention in the hands of your mom. Yeah.
So, towards the end of this, do you have any insight or advice for our women out there or for children out there, how to manage a balanced lifestyle to avoid diabetes and similar disorders in life?
No, they have to have a regular actually counseling kind of thing. See, pregnancy also is connected to actually stress.
Yeah.
Because actually, it's a lot of stress, on women actually, we can, depending on the socio-economic status, whether they are actually, poor or, rich, there is a component, depression component is there actually. So they should have a social counseling, proper lifestyle modification, exercise, yoga. Yoga can actually very helpful because it has actually a lot of actually circuits. The organ circuits are actually helping, and those kind of lifestyle modification along with some kind of actually medical management will help. But people will actually wait until actually 24 to 28 weeks kind of thing. But even from the first trimester, there should have a counseling. Then it definitely helps. It is a good for the mother and the future development. See, a lot of actually risk factors actually operate in South Indians at actually, very, very actually, the left side kind of thing. Say, for example, inflammation, inflammatory markers, and many, many actually, parameters. Even with the less threshold, we have risk. See, for example, BMI. See, Asian Indian cutoff BMI is actually, little different from actually world cutoff. Even with actually 23 to actually 30, we have overweight and, obesity kind of thing. And there is a study in, diabetes. A short-term 5-day high-fat, high-calorie consumption in healthy Indian, South Asian men imposes actually insulin sensitivity and insulin resistance, not in Caucasians.
Oh,
Just five-day high-fat, high-calorie diet.
okay.
And physical activities also, people are telling
Yeah.
we need little bit extra prescription physical activity. There is a study showing that usually physical activity is actually, they say 150 hours per week. That means 30 minutes per day, at least for 5 days like that. That is a worldwide prescription for exercise. But that is not enough for Asian Indians. We need, instead of 150 hours, there is a calculation. We need 232 hours extra exercise prescription. But it's all education, empowering the disease.
Yes.
See, diabetes actually usually, we are not panic and we can say only it is not a disease, it's a disorder. But it's not neglected. Once neglected, actually, if it comes to actually complication and starts actually, the morbidity problem.
I hope with this video, a lot of people get to know that how important it is to have physical fitness. That will definitely ensure our healthy lifestyle will be ensured with that. With this, I would like to thank you for your time and wonderful insights that you have shared with us. And I hope they are really helpful to a lot of people and help them get better understanding of these disease and to prevent them altogether.